Assist in the Congress. Mr. Carter, how's that?
That's very good. Thank you.
I know that.
Thank you, Madam Chair. And thank all of you for being here. This is certainly important, and we appreciate your being here and helping us with this. I wanted to start by saying that I'm very honored to be the Republican lead on HR 3031, working with Representative Chu and Engel on the National Quality Forum. I think it's very important. It's very important because it's a valuable resource for making sure that we have and that we achieve cost-efficient and high-quality and value-based health care that ensures that all Americans will have quality health care, and we certainly need to continue this program, and that's why I'm proud to be a part of that. I'll start with you, Mr. Riccardi, and just ask you, you mentioned it in your testimony, and I wanted to ask you if you could just expand a little bit more on the value of the National Quality Forum, particularly as it relates to Medicare recipients.
Thank you for that question. And to add, the saying goes that it's important that an individual gets the right care at the right time, at the right setting, and you may want to add also at the right cost. And the National Quality Forum has created the highest level of quality standards that are available to states and agencies in both, as I mentioned, the private and public sector. And in particular with the Medicare program, with the preventable readmissions program, we've seen some success and decrease in those emissions. And I know from my background, I also am a lecturer at the Columbia School of Social Work, and a number of my students have been involved in some of those demonstration programs helping prevent readmissions. And the accessibility and the use of those quality measures have been key to ensure that people are receiving the right care at the right time in the right setting.
I can't help but remember I was a consultant pharmacist in long-term care for many years, and we used to have the 7 rights of drug administration: the right drug for the right patient, the right dose at the right time, right administration, so on and so on. So you're exactly right, and I appreciate you reiterating that. Mr. Burke, I want to change gears real quick and talk about dish payments. I've got a very rural district in Georgia, South Georgia particularly, very rural area, and my district, certainly to the western portion of my district, is very rural, and dish payments are extremely important to our rural hospitals, and some of them are totally reliant on this. So I understand that there are some hospitals or some states that aren't using their full dish allotment, and I find that hard to believe, and just wondered if you could explain how that can happen and what's going on there.
So my understanding is that there are 3 states, if I'm not mistaken, there are 3 states that are not using their full dish allotments, and I assume that is because that there is as well as a state-specific cap in dish, there's also a hospital-specific cap. Medicaid dish payments cannot exceed the amount of uncompensated care that a hospital has. And so the only thing that I can think of is in those 3 states, those hospitals are being paid at least the cost of their uncompensated care.
MACPAC had made some recommendations that on potential reforms, and I think you may have mentioned some of these. Do you have any other ideas or any other suggestions on what we can do in Congress to make sure that this program is being utilized like it's supposed to be?
Thank you for that question. You're right. I did mention the MACPAC recommendations, and one of them addresses exactly the issue that you mentioned, which is applying the dish reductions to those states that have not expended their full allotment, which would sort of hold, for at least a portion of the dish costs, hold everyone harmless. Another recommendation that MACPAC made is to rethink the way that the dish caps are allocated right now, because they don't really bear any relationship to low-income or uninsured patients.
That is important. Thank you for bringing that up, because we do need to look at that, and if there's reform needed, we need to address it.
Thank you, sir.
Well, again, thank all of you for being here. This is extremely important. We all understand that. I'm concerned about how we're going to pay for all this, but at the same time, there's no question that these are quality programs that need to be continued on, and certainly, whereas we need to look at some reforms on certain programs like the dish payment system, I want to make sure that particularly the rural hospitals understand that we understand how important it is to them for their survival. So thank you, Madam Chair, and I yield back.
Gentlemen,